Today we're going to talk about vision therapy. I'm Dr. Shelley Kim. I'm fellow of optometrist in vision development. I named my vision therapy as P.E Technology because I think we do more than traditional vision therapy. We really help person to perform much better than before. We do traditional vision therapy, we do light therapy called syntonics. I incorporated some Eastern teaching. Whatever that helps a person to perform better, I incorporated in my vision therapy. Now, what do you see in this picture? What do you see first, the girl or the older lady? Being able to notice there's a girl, beautiful girl, and then an older lady is called vision. If you only have sight to see the color and the lines, you can't really make sense out of the picture easily. And in the background, there's another person's face in the dark. Now, visual abilities, why is it essential in achievement? Because more than 80% of learning comes from seeing. And what we see must be correctly processed for us to understand. And there are many aspects of visual ability. Just to name a few: visual acuity, eye movement control, eye coordination, eye-hand coordination, focusing ability, directional concept, visual form perception, visual intake, visual memory, peripheral vision, and our posture and perimeter reflex, they all matter to our visual system. First, we're going to go over visual acuity. This is what we talk about whenever we go take our vision exam. They tell you you're 20/20, 20/40. It's just measure of your clearness of vision. It doesn't really tell you how much effort it takes for you to see or how clear it is to read something. So this is just function of clear sight, and when you have difficulty with the visual acuity, you'll see people squinting and see blurry. Eye movement control is next. This is necessary for us to shift our eyes along the page or following a moving ball. So there are three types of ocular motility. There's pursuit. It's the smooth tracking of eyes, and there's a saccade where you jump from one point to another precisely, and there's a fixation where you can fixate on a target for steady and required time. So because you need ocular motility for smooth tracking and moving from one line to another, from one page to another page, or from the chalkboard to near, if you don't have good ocular motility, you'll have difficulties like losing place, needing to use fingers to read, and skipping small words when you're reading, and very difficult to catch a ball. And you end up rereading. So here's my boy learning to tracking a ball. And here's just some pictures how some children use their fingers to read. And here, children who are using their index finger are a little bit better than the ones who use middle finger, because at least index finger in Eastern teaching is connected to your eyes. The middle finger is connected to your brain. So kids who point with their middle finger, they're compensating even more than the children who are pointing with their index finger. Now, the focusing ability is called accommodation. This is highly related with attention, our mental attention. This is the ability to see clearly near and see clearly afar, back and forth, and sustaining, maintaining your clear vision up close. So when this is not working well, you have difficulty copying from the chalkboard because your vision's not changing its focus quick enough to see far to near, and it's really difficult to finish a task because the text may become blurry before you finish your work. So a lot of times kids will or people will complain that they're tired, or they keep rubbing their eyes to make it better. So imagine if someone's trying to read a book And that's how it looks, how difficult it would be to read and continue to finish. So when they try really hard, you see people squinting or rubbing their eyes. Eye coordination, we call it binocularity, is with the ability to make two eyes work together for the target. So when you don't have good, efficient eye teaming, you will have difficulty with making the eyes straight on. So some people have eyes turned in or turned out, or they suppress one eye. They look the same, but one eye is not functioning. Or they may see double vision. So when you see double vision, your depth perception is very off, and your attention span will be shortened because it is very confusing. I'll show you some pictures of eye turn and some examples of double vision. It just hurts me to look at these pictures even for a few seconds. Imagine someone who's seeing double vision constantly. It's just unbearable. So the children with poor binocular vision appear to be lazy or just not interested in the work that you need to do. Next is eye-hand coordination. Your eyes will have to be coordinated with your hands through your brain. When your eyes are not connected to your hands, your handwriting suffers, and it is very difficult to catch a ball. So sports and handwriting, fine motor skills like cutting or coloring will be all difficult. So eye-hand coordination is essential in sports and writing. And directional concepts, knowing your right to your left and knowing right and left outside of your body, top and bottom. This is so important, being able to be able to read books, letters correctly, because when this is not set right, you're going to reverse letters often, and you're going to misread numbers and letters. And following direction will be difficult if it involves sidedness, right and left. So they often are viewed as dyslexic people because they keep reversing their letters and numbers. Next will be visual form perception and reproduction. This is the ability to be able to perceive something and understand what they're seeing, like the picture that we saw earlier, the girl and the older lady. So when the perceptual skill is not good, it's very easy for them to miscall words or words that look similar, and reversing letters also. So it's harder for them to read correctly. And here's my second boy learning to improve his perceptual skills with circuitry. Visual intake and memory and visualization. This is very important for reading comprehension. You have to be able to intake information and retain it long enough for you to make sense out of it. And this is also important in sports performance, being able to visualize what you're going to be doing and actually taking the action to do it in real life takes visualization skill. So people often ask me, why do children have vision problems? This first, hereditary issues definitely there. They're born with your genes, but with the environment matching up with their gene, it's gonna surface. And during pregnancy, if the mother was sick and needed to take some medications or had high fever or high stress, could cause some disorganization in their brain and their visual system. And delivery, during the time they're delivered, if it took too long, longer than 6 hours, less than 6 hours, can be stressful for the child. And using forceps or the C-sec, those can also create some stress from the beginning. In the first year of development, it's very crucial for them to be able to crawl normally, but some children skip or crawl in an awkward way, and that usually indicate there's some problems with their visual system or the body coordination. And walking too early or too late also can indicate that there is some problems with their vision. In first 3 years of high fever or falls or their awkward posture because of overuse of our car seat to high chair, they're not mobile enough to learn how to coordinate their body. When they don't know how to coordinate their bodies correctly, their eyes will not learn how to coordinate them together either. So lastly is the primitive reflex and posture. I'll talk about that. Primitive reflexes is something that babies start practicing at 9 weeks of conception so that they can survive better right after birth when they don't know how to protect themselves. And this is so important. There are a few primitive reflexes that are very important for visual development. The first one we're going to talk about is the Moreau reflex. It's the one that's necessary for survival. When you start a baby, they go ah, to kick off something, whatever that fell on their face, and take a deep breath and scream for mom's help. When this is not integrated correctly, they'll be very sensitive to sound, touch, or even light, and they become very anxious easily and very difficult for them to balance or coordinate their body parts. Tonic labyrinth reflex. This also affects them if it's not integrated correctly. Problems with balance, motion sickness, extremely rigid or floppy muscle tone, difficulties with eye movement control, eye teaming, spatial concept reversal, figure ground, sequencing and organization, auditory processing. Spinal galant reflex is something that needs to be integrated by 9 months, but these are the children who cannot sit still, who have attention problems, and who have difficulty with potty training, bedwetting over age 5. Asymmetric tonic neck reflex. When this is not integrated, they have difficulty crossing the midline, so their eyes jump in the middle, so it's harder for them to read and understand what they're reading. And they also have difficulty with their handwriting. Symmetrical tonic neck reflex is the one when it's not integrated well, they generally have difficulty changing their focus far and near, and awkward, stiff walking, swimming is difficult, eye-hand coordination is difficult, they're generally clumsy. Head-writing reaction reflex, this also, when it's not integrated, they have difficulty with eye movements, reading difficulty, comprehension, and spelling. Palmar reflex, when this is not integrated well, they have difficulty holding their pencils, difficult to write with their hands, fine motor control is difficult. There are many more reflexes, primitive reflexes, but I only went over the ones that will directly affect our academic performance. Here's some pictures of pencil grip. And the good posture is very important for our good binocular system. Standing tall and sitting tall, lying down straight, walking heel to toe, all very important. I can show you when we have time for that. We have additional information for my contact information here. And another picture to figure out what that is. If you have sight, you can see black and white blobs. When you have good vision, you'll also be able to figure out what those patches of black and white. Thank you.